it's good to get, for us as doctors, to get feedback when we speak to bigger groups about what's getting through, how can we communicate better. And so this is really educational for me as a doctor, as much as it is for you, I hope. So I'll talk for a minute about the importance of radiology. So as Shelley and Scott and others of you guys know, I'm married to a radiologist who is an ILD specific trained radiologist. And so I get I'm very familiar with how important radiology is in general. And I get a lot of free extra consultations on if I ever have a question about it. And this is because having a high resolution CT scan, some of you may have had the experience of having had a regular CT scans at a different doctor's, and you go and see your lung doctor and they say, well, I really would like you to get a high resolution scan. And I want to take a second to explain why sometimes we ask for that second scan, which seems like, well, I just had one. Why are you asking me to do another one? And the reason is because high resolution CT scans have thinner cuts. So our just the same as like an iPhone today, the pictures are sharper and clearer, way better than back in 2009. So they're better pictures. It's always a non-contrast study, which means they don't give any IV contrast, because the IV contrast messes up our ability to see details about the lung parenchyma or the actual space between the alveoli. And when you do a true high resolution CT scan, there are 3 full views. One when you breathe in, one when you breathe all the way out, and then one when you're prone, meaning on your stomach. The reason for that is those maneuvers can show whether or not any of the changes on your, especially subtle findings of ILD, change with position, meaning is gravity causing it? And also if you have something called air trapping, which I'll explain a little bit more in a second. So this is an example of what we call air trapping, a patient that I've taken care of in the past. And what we're seeing here is that in the abnormal areas of sponge on either, the lung sponge on either side of the heart, there are different spots when this patient breathes out that are different colors. And the different colors relate to how effective or not that patient is at getting air out when they expire or breathe out. And so that arrow kind of points at certain spots where that's happening. Air trapping basically is caused by when the interstitial lung disease or the problem the patient's having is primarily focused on small airways, commonly seen in things like asthma and COPD, but when it's severe, we worry about a component of bronchiolitis and hypersensitivity pneumonitis, which we talked about just a second ago. I think there are a couple of questions. So Shelley, should I have people unmute for that?
I have a question. So your last screen said that HRCT scans are your friend, but in a way that's a little misleading for a patient, whereas it has radiation. So that's really, I mean, it's not ideal to have many CT scans a year because of the radiation. Is that true?
Well, it's true, but hopefully you should not be getting repeated high resolution scans. Like usually we do like one. So for the most part, and a lot of times my patients will ask me at my visits, well, don't you want another CT scan? I had one like 6 months ago. Like, don't you want another one? And for most patients, I don't scan them repeatedly. It's only if something is changing, or I'm concerned that something is different than the original scan. But at the first visit, especially when you're in the process of diagnosing an ILD, that first scan, it can be very useful to have a high resolution scan.
You answered my question. Thank you very much.
Mm-hmm. I think there's another question from, I can't tell the names, but there's a hand up.
Good morning, everyone. I was just wondering, the air trapping pattern on the screen, is that the same as something called mosaic attenuation?
So mosaic attenuation can suggest air trapping. It's not like definitive. And the reason I want to bring that up is mosaic attenuation is it refers to that kind of mosaic pattern where like there's different like a slightly gray, darker gray, like next to each other. But the important thing to remember is that all radiology findings have to be taken in context. So some amount of air trapping can be seen even with just asthma. And there's a debate kind of in the field about there may be a little bit of air trapping that's like, quite frankly, like there's some mild air trapping can be normal. Like I may have mild air trapping on if I did a high resolution CT scan. So the extent of it is important and the context is important. And mosaicism, just so y'all know, can also be seen when you have heart failure, like too much fluid on your lungs, and or can be seen in pulmonary vascular disease like pulmonary hypertension. So in and of itself, it's important to understand that like the radiology alone is not the Bible. It's a hint. The doctor has to take that information and put it in the context of everything else going on.